Thank you, Chairman, sir. So, first of all, I'd like to thank Professor Drabajit Sarkar and Dr. Yogendra Malik for introducing me into all of Sewa International, and also thanks to Sewa International for inviting me to speak on this very important topic. So, I did my MD from AIMS. Okay, I did an MBBS from Kerala. It's Kottayam, just to be corrected. So my today's topic that allotted to me is technology in healthcare for achieving equity. So, and I come from the easternmost part of the Himalayan. That is for Arunachal Pradesh in India. So before going into topic proper, so I will just a little bit description about Arunachal Pradesh, and then I will go to technology. And before that, I will begin with just few words. Uh, Technology in healthcare for achieving uh, equality is very is achievable, but the achieving equity is in the sector is not impossible, but it's very complex. With this word, I will speak. This is my state. Probably you all know about the Arunachal Pradesh. It has been in news for the past few weeks. So it is in the western side we have a Bhutan, then the northern and the southern this eastern part is covered by China, and then we have Myanmar, and below is our Assam. So in Arunachal, this is a landscape. It is 83,000 square meter, and it encompasses 2.5% of India, and for Northeast it is approximately 32.8%. Okay, so as per the 2011 census, our population's density is just 17 people square per kilometer, and we have a total population of only 13 lakhs 83,000, and we have around 5,500 villages, 17 census town, and 9 urbans, and we have 26 major tribes and around 104 sub-tribes with different languages. We understand each other's, but there is no written dialogue. So, topographically, we have three distinct ecological zones. That in the southern part, we have Assam. This is a plain area. Then we have hilly and mountainous area. So, owing to rapid changes in the topographical and altitudes, so climate condition changes very fast. Sometimes there will be rain, then suddenly there will be sun. So, though it is a strategically located in, part of India, so but it's considered as a backward in terms of traditional sense of economic parameters, because we are totally dependent on the center for the every budget allocations. Though we have enormous potential in hydropower, but that is not being tapped. Now it's the government is under present governments, it is being tapped and being generated, and a lot of projects going on the hydropower. And apart from this, there was a long isolation and separation from mainstream states. So apart from that, also there is a challenge topographical inhospitability. Then there is a challenging climatic conditions and communications. This makes the cost of creating and maintenance of infrastructure extremely high. So, and after independence, like a lot of state had inheritance from something from the British Raj, but in our Arunachal we did not have anything, and they could not penetrate in our villages and our states. So there was just a 100-kilometer road at the time of independence. Even now we have a communication is going on, a lot of development projects going on. Still we have in the summer region, you can see in the photo, we are filled with muds. Okay, there is a chance of landslides, every possible. So it may be in blockage, it can be stoppage of communication can be from hours to, it can go up to months, because the road may be totally collapsed. You have to repair it, it may take a month. So what are the problems in my states? It's the eastern Himalayan regions. So one is the foremost important is the connectivity. So only recently we have air connectivity, all weather air connectivity. Recently, our PM has inaugurated the airport in Itanagar, Olongi. So just 1 month back. So railway connections also just a few years back we had. Just it's just 4 years. So and communications. In communication sectors also, we are very lagging. Still, we have a little bit of in the main urban and the towns, we have a communication mobile phones. Then a lot of internet issues there. In the peripheral, there is no internet, no, we cannot communicate with that. The isolated part is still there in my states. So apart from that, and the climates, and as I mentioned, climate and topography, and the problems apart from this, the budgets. The central budgets comes and state budget also. That's basically they make based on the population base, number of population base. Since our state have a vast geographical area but very less populations, so budgets comes and uh, that's not sufficient to meet the challenges that we face. And lastly but not least, then train and motivated human resource. That's not there. So with this problem, I will go to my topic proper, technology. So I will be dealing with HMS, PSA, telemedicine, and this is just outlines, just in very brief. So this HMS is a hospital management information system. It has been used in every corporate hospitals and every central of institute, significance institute, and it's used. So this is very important because we need for every successful programs, every successful implementation, we need a data. And data collections now it is paper based. Every time paper based is another solutions, and it has to be transported, and it has to be human resources involved. Lot of activity, lot of time constraint is there. So this can mitigate this problem with HMS. So now our work is going on this digitalization healthcare centers. We have this under earlier we had a PHC, then CHC, then sub center we have. Now apart from that we have under present government we have a community wellness center. Health and wellness center is there in every pocket of the district. So in that we are supplying every computerized digitalization of health center and the creation of unique ID, that is about Ayushman Bharat health account, to which health record will be linked. It's not implemented, it's a pilot project is going on still. So once this will implemented, I think we will get a lot of data from different part of the source, different part of the district, and then we can have a what are the solution, what are the our health issues we can find out with this. Then this is oxygen concentrator. So there was within the COVID time, there's a lot of organizations supplied us, a lot of NGOs, lot of self-help groups, and even governments they have supplied. There's a pressure swing absorption technology. That's oxygen concentrator. Earlier we had in our state we had just a oxygen cylinder, that black one. This black one. This is just fill in, just like a gas cylinder. You have to fill and you have to replace it. And we don't have any refilling system. We are more dependent on Assam. Nearest was the Lakhimpur. It is just almost 45 kilometers from my medical college. So we had only this much. Now with the coming of COVID, now we had procured, this is a liquid medical oxygens we are using now. Then the government of India, we have from the PM cares or DRDO, they have given us a 1000 LPM, this PSA technology, PSA plant. Then we have got the 600 liter supplied by UNDP, and there is a lot of oxygen concentration supplied by various departments. This detail I know because I am in charge of this, because I am the nodal officer of oxygen in the TRIHMS Medical College. So pressure swing technology, why I have added this one is this very easy actually. This machine needs a light, electricity is necessary, and this we have enormous amount of the air. It just selectively it absorbs the nitrogens and it will give the oxygens. So it may not be 100%. So possibility is just 93 plus minus 3. Okay. Then next is telemedicines. During the COVID times also we have set up telemedicines and tele-ICU also with the help of lots of corporate sectors. Though especially in the quarantine centers like a telemedicine where you are difficult to go in, difficult to approach. This telecommunication was a very important part of this. And now also in a different part of the district we are utilizing telemedicines for teleconsultations. Any patients who are not sick on OPD basis, they can communicate us. We have e-Sanjeevani website is there. We are implementing in at least in my institute in the TRIHMS. We are having e-Sanjeevani telemedicine department, and all the people from wellness center they can be communicate with the there will be one nursing officers which will make this link to us, and every day one doctor will be posted in this telemedicine center. Okay, he will help in the prescribing for the minor illness. For major, they have to refer to us. Then tele-ICU is the same. So we are connecting with every district also, but it's not in just one or two center we have connected. And Pasigat, if people knows, 2-3 people from Arunachal also there. We have connected Pasigat and the Tailang in regard to tele-ICU. Then little bit of artificial intelligence. So this is associated with the mimicking human intelligence or cognitive functions by the computers. So this also comes just like data collections. All must be, or not all, some must be wearing a wearable watch also. Sport watches, many of them, heartbeat will be there, calorie will be there. And we can track your health record also. It can be centralized. That is wearable. Then for us, like a medical college, we can have a virtual clinical trials also. Okay, this I will skip. Then lastly, drone technology. So drone technology is also implemented in the pilot project as a pilot project in the Arunachal, in Sewa. So what? So still we have a place in Arunachal that healthcare is not accessible. There's no road connections. Just healthcare workers has to travel 2 or 3 days also sometimes to carry vaccines. You have to give polio. You have to give something. Central program is there. You have to reach out them. So drone technology has been used for this. They can carry I don't know about the payload, how much they can carry, but they have tried with the vaccines. They have tried with essential medications, and even blood reporting. From this other side, they will collect the sample and they will return back to us in the center. Okay, with this much, my topic is end here, and thank you for nice listening.